In this lecture, we're going to look at the perineum and external genitalia. So look at the perineum, which is this shallow space inferior, or it can be considered to be superficial, to the pelvis and the pelvic floor. We're going to look at the boundaries and the divisions of the perineum, and specifically we'll look at what's called the ischio-anal fossa. We'll look at its boundaries within the perineum and also its contents. And then we'll go on to look at the perineal pouches. And these can be particularly complicated. The deep and the superficial perineal pouches, and some sex differences we find for the male and the female. And then we'll look at the neurovasculature of the perineum and return to the internal pudendal artery. So as I mentioned at the top, the perineum is a shallow space which is inferior, or it can be considered superficial, to the pelvis. It contains a number of important structures, including muscles and erectile tissues, and these are associated with reproduction. So let's first of all just try and orientate ourselves as to where the perineum is located. Now here we can see we have hemisections through the male and the female pelvis. We can see we have male here, another male here, and a female. We have three sections through the pelvis. We have anterior here and posterior. Again, anterior, posterior, anterior, posterior. You should be familiar with these images by now. And what we can see is here the organs haven't actually been hemisected, although the bones of the pelvis have been hemisected. And on this side have been hemisected directly down the midline. Now, what we can do is just draw a simple line that separates the pelvis from the perineum. So if we go from the pubic symphysis all the way around up to the sacrum and the coccyx, everything above this line is the pelvis, everything below it is the perineum. We can do the same on these ones, which have been hemisected through the organs. Pubic symphysis to the coccyx. We can see everything above it is in the pelvis, everything below it is in the perineum. So in the perineum here, we're including the penis. We're including muscles that guard the anal sphincter. In the female, we can do the same. We can see that the urethra passes through from the pelvis to the perineum, passing through the pelvic floor here. We can see the same applies for the vagina here, opens up into the vestibule. And we can see the same for the rectum, which is here. Here we're going to identify some muscles that guard the anal sphincter. So this just hopefully gives an introduction to where we're going to be investigating, an area which is superficial or inferior to the pelvic floor. Here is just a sentence which summarizes what we're going to do. It's this: investigate this shallow space, superficial, inferior to the pelvic cavity. And it's levator ani, these muscles that we've been indicating, which we looked at in the previous lecture. Levator ani is going to be the partition that forms the pelvic floor that separates the perineum from the pelvic cavity. So let's look at the boundaries of the perineum. This is an inferior view of the bony pelvis. We have anterior up here and we have posterior here. We have the pubic symphysis. We have the inferior pubic ramus. We have the ischiopubic ramus. We have the ischial tuberosity here. We have running from the ischial tuberosity to the sacrum, the sacrotuberous ligament. And here we have the coccyx. And we can see that that creates this diamond shape. If we do that again, we can see this diamond shape has been created. Anteriorly, we have the pubic symphysis. Laterally, we have ischial tuberosities. Posteriorly, we have the coccyx. If we connect these four dots up via the inferior pubic rami and via the sacrotuberous ligament, we can see we have this diamond shape. This diamond shape can be divided into two triangles via a transverse line at the level of the ischial tuberosities. So if we were to draw a transverse line across the ischial tuberosities, we've split this diamond into two. We've split it into a more anterior triangle. This is the anterior aspect, a more anterior triangle. And we've split it into a more posterior triangle. This is the posterior aspect. So we now have this diamond split into two. This anterior triangle is known as the urogenital triangle. And what passes through this triangle in the male is going to be urethra, and in the female, the urethra plus the vagina, the urogenital triangle, this triangle here. The triangle that's posterior to it, that just contains one aperture. It's known as the anal triangle, and this anal triangle allows the anus to pass through. So we're looking at this as if someone is laying on their back. This is the posterior aspect. Anterior is up in this direction. And we're looking through into their perineum. With their external genitalia removed, we can see the pubic symphysis, we can see the coccyx, and we can divide this diamond shape into two triangles. Urogenital triangle, anal triangle. Within these triangles, we'll have those apertures for the urethra, the vagina, and the anus. So now I just want to concentrate on the perineal membrane. And the perineal membrane is just associated with the urogenital triangle. It's just associated with the urogenital triangle. And that's what we can see here. If we look at this view, this anterior view of the pubic bone within the pelvis, this is superior up here, this is inferior now. We can see the ischial tuberosities, we can see the pubic symphysis, and we can see the inferior pubic ramus. So here, if we do the transverse line again, we can see we've created this triangle, which is the urogenital triangle. And we can see that just filling this urogenital triangle, just occupying the urogenital triangle, is a shelf-like structure, a shelf-like thin membrane known as the perineal membrane. We can see that in this perineal membrane, there's a couple of holes. In the female is a good one to use an example because there's two holes. We can see we have a hole for the urethra. We can see we have a hole for the vagina. So these structures are passing through this perineal membrane at the level of the urogenital triangle. We can see surrounding the urethra is the external urethral sphincter, and we'll explore other muscles in this area as we go on. But this perineal membrane is just located within the urogenital triangle. If we were to explore some other muscles, then if we can appreciate that we've got the perineal membrane here, and that is just a shelf that's been put in the urogenital triangle. So if we were to do a transverse section through, we could see the perineal membrane here, and then we'd have the urethra passing through it. So we'd have the perineal membrane here, attaching to the ischial tuberosities, here. And then we've got this perineal membrane that's just running across from ischial tuberosity to ischial tuberosity. Here, if we could imagine the section has been taken along here. And here we can see the free edge of the perineal membrane where it stops. Now, associated with this posterior border, there is going to be two muscles, deep and superficial transverse perineal muscles. Along this posterior border, which we can imagine is here, this posterior border, there's going to be a deep and a superficial transverse perineal muscle layer. Here we can see the deep transverse perineal muscle, and here we can see the superficial transverse perineal muscle. And these lie along the posterior border of the perineal membrane, running from ischial tuberosity to ischial tuberosity. Now, where they converge in the midline here, we find we have this fibromuscular structure, this fibrous mass, and that is known as the perineal body. The perineal body. And the perineal body lies directly posterior to the vagina, along the posterior border of the perineal membrane. It's in the midline, and our perineal muscles converge into it. It's known as the perineal body. More posteriorly, we then find the anus. Located posterior to the vagina, or the bulb of the penis if we are in the male, we then would find the anus and the anal canal. And the perineal body is positioned between them. So now let's go on to looking at the anal triangle. The anal triangle is now at the posterior level of the perineum. So we've moved now behind the perineal membrane. And what we've done is we've made a section, a coronal section through the pelvis. And now we need to remember the lateral boundaries of the pelvis. We need to remind ourselves that if this is going to be the ischium over here, and then lining on the ischium we have obturator internus muscle. This is obturator internus muscle. And what do we have lying over obturator internus muscle? Obturator membrane. What do we have? A thickening of obturator membrane here, and a thickening of obturator membrane here. We have the tendinous arch. We have the tendinous arch of obturator membrane. And what comes away from the tendinous arch to merge in the midline? The pelvic floor muscles, specifically levator ani. And this is what we can see here, running towards the midline. What we've done is we've cut this transversely in line with the rectum. We've cut it coronally down through the rectum. Now, because the rectum and the anus, which we can see down here, is positioned within the anal triangle, and because the anal triangle does not contain the perineal membrane, we can see there's no structure traversing between the ischial tuberosities. We see there's no structure traversing between the ischial tuberosities. That means we've created this space here. Laterally, we've got obturator internus muscle. Medially, we've got our levator ani muscle. And inferiorly, we've just got this skin here. This skin, this perianal skin that surrounds the anal opening. Which means we've got this nice space either side of the rectum. We've cut it down coronally. What this space is called is the ischio-anal fossa. And this is a fat-filled space that sits either side of the rectum and the anal canal. It's a wedge-shaped space. A wedge-shaped space, which we can see again here, that is lateral to the rectum and the anal canal. Remember that we've cut coronally down through the anal triangle. And at this level, the perineal membrane does not exist. Really important that the level of the anal triangle, the perineal membrane does not exist. Therefore, there's no separation into deep or superficial compartments, which we'll see when we look at the urogenital triangle in more detail. Let's have a look at the boundaries. Laterally, we have the ischium, which we can see here, and we have obturator internus muscle and obturator internus fascia, which we can see here. Medially, we can see we have the anal canal with levator ani and external anal sphincters. We can see these here, external anal sphincters down here. Posteriorly, we can't see this, but we know the posterior boundary of the anal triangle is going to be the sacrotuberous ligaments. Remember that from the diamond shape arrangement that we saw. And also we could have part of coccyx in there as well. And anteriorly, what are we going to have anteriorly? Well, what do we find anterior to the rectum? We find we have the vagina, or we find we have the urethra. So we find we have the muscles associated with those. External urethral sphincter, the deep and superficial transverse perineal muscles. And what we also have is the fat within the ischial fossa passing into the deep perineal pouch. The deep perineal pouch being located at the level of the Eurogenital triangle, which is positioned above the perineal membrane. And this extension of the ischial fossa anteriorly into the deep perineal pouch is known as the anterior recess. We'll explore that in future slides. So, let's just stay with the ischial fossa and look at its lateral wall for one moment. So the ischial fossa and the lateral wall. Now, what I've got on here as well is the branching of the internal iliac artery that we did in a previous lecture, because we now need to remember the arrangement of the internal pudendal artery. So, what we've done is we've got a image of our ischial fossa here. We've got levator ani and we've got our obturator internus membrane. We've got the same on this side. And if we turn to this diagram, we can imagine that the pelvis has been sectioned coronally down like this, in this direction. So it's been sectioned coronally down, and that's what we're looking at on this side. So what have we done? Well, we've cut through the ischium, which we can see here. We've cut through the ischium, which is what we can see here. And we've also cut through an important blood vessel. We've cut through this blood vessel here. Now, if I just get rid of those previous marks, we can see that we've cut through this blood vessel. Now, what did this blood vessel do? It left the pelvis via the greater sciatic foramen, inferior to piriformis. It left via the greater sciatic foramen. It then hooked around ischial spine, sacrospinous ligament. It hooked around. And now, as it hooked around the sacrospinous ligament, remembering that coccygeus runs on the pelvic surface of the sacrospinous ligament, it's now going to be running under the pelvic floor. So it left the pelvis, hooked around ischial spine, sacrospinous ligament, to now run within the perineum. It found a way to run underneath the pelvic floor. Now, it's running alongside the ischiopubic ramus. As we cut through it, we can just make out the internal pudendal artery there. Running alongside, in this direction, obturator internus muscle in a structure known as the pudendal canal. This is an important compartment within obturator internus fascia, and it contains the pudendal nerve, which is important to provide innervation for the perineum, but importantly, looking at the arterial supply from the internal iliac, it's containing the internal pudendal artery and also the internal pudendal nerve. It's running along the medial aspect of the ischiopubic ramus, running along the lateral wall of the ischioanal fossa. Coming from it are going to be the nerves and the blood vessels that supply the inferior part of the anal canal, supply this region down here. So running through the ischioanal fossa, we're going to be having the inferior rectal nerve, artery and vein running through the ischioanal fossa to supply the inferior anal canal. Okay, in future slides, we'll carry on looking at the branching pattern of this internal pudendal artery. But really, that's all I want to say about the ischioanal fossa. It's a really important space The fact that we have this fat-filled space lateral to the rectum allows for the feces to expand into this space during defecation. Okay, now let's look at the anal canal. The anal canal is particularly important because it's the terminal part of the gastrointestinal tract. It's direct continuation of the rectum. And we spoke about the rectum in the previous lectures, and we can see the transverse fold to the rectum here. We can see the rectal ampulla, which stores the feces prior to defecation. But we then had a junction between the anus and the rectum, the so-called anorectal junction. And this junction is in line with levator ani. Where levator ani is coming down from its lateral attachments, that creates a junction known as the anorectal junction. Everything beneath that line is the anal canal. Everything above it is the rectum. And which part of the levator ani goes around the rectum? The puborectalis. Puborectalis. So, the anal canal is the distal portion of the gastrointestinal tract. And importantly for this lecture, it's located in the perineum. It extends from the superior limit of the anal columns. So here we can see some anal columns that are really starting at the anorectal junction. And it runs down to the anus, which we can see here, this opening. This anorectal junction, as I've mentioned, marks where puborectalis sweeps around, and this constricts the lumen, helping to prevent feces from passing out. The anal columns, these contain the terminal branches of those superior rectal vessels. Also the middle rectal blood vessels as well, if they're present. But these will be coming down the superior rectal blood vessels that have supplied the rectum above. The anal columns are containing those terminal branches of the superior rectal blood vessels, which means beneath them, this region is going to be supplied by the inferior rectal arteries. And remember, the inferior rectal, as we just saw, came from the internal pudendal, which is a branch of the internal iliac. Inferior of the anal columns, we find we have some anal valves and we have some anal sinuses. These sinuses release mucus, which is important with defecation, and when the feces passes through, they become compressed, they release the mucus, and they support the feces from exiting the gastrointestinal tract. The inferior anal valves form this pectinate line, and this pectinate line is important because it separates the superior and inferior aspects of the anal canal. And importantly, this is where the skin creeps in and the mucosa becomes keratinized. You go from this digestive membrane that we had in the gastrointestinal tract, and it actually changes as we get into the inferior anal canal, as the skin becomes keratinized. And at this region, it's important because we really have different lymphatic drainage from this region as well. We have different nerve supply, where we have parasympathetic and sympathetic above, and we have somatic below. So this pectinate line really does mark an important transition. And here we can see that in more detail. The anal canal superiorly and inferiorly. We can see we have the difference in the arterial supply, superior rectal arteries, and we've got inferior rectal arteries coming from different origins. We have superior rectal veins, which from the superior aspect drain into the portal system. Inferiorly, they drain into the systemic system, and we spoke about these portosystemic anastomoses. We'll come to the lymphatic drainage in another lecture, and we'll look at the nerve supply too in another lecture. But this is a good reference table to remind you of the differences between the superior and inferior aspects of the anal canal. I want to talk about anal sphincters for a moment and how we can control those sphincters, and also puborectalis. What we have is a picture hemisection through the rectum on this side, and on the other side we have a transverse section through the pelvis. What we can see is that here we have anterior and here we have posterior. In this transverse section we have anterior and we have posterior here. Anterior in the male, we've got the prostate, and then we have the rectum here. We can see the circular and longitudinal muscle layers of the rectum here. What we can also see is that coming around, if we look at this transverse image, coming around from anteriorly, we have this sling-like arrangement. And this sling-like arrangement, coming from the pubic bones on both the left and the right side, is puborectalis of levator ani. Puborectalis. It comes from the pubic bone and it sweeps around the rectum. It's coming in this direction here, and then it's going to sweep around the rectum, and then going to go and attach to the other pubic bone. So it creates this sling. Now, that is contracted, and that creates this angle. Called the anorectal angle, and which is maintained by puborectalis. And this once again helps to control defecation. Relaxation of this muscle will straighten that angle and ease defecation. We also have a number of other muscles that are involved in maintaining fecal continence, and we have external and internal anal sphincters. And we can see these here. If we look at the internal anal sphincter is going to be a thickening of the circular and longitudinal muscles which we have running around the rectum. So we have a thickening of these smooth muscles. So we can see these running around in here. We have a thickening of these muscles, and they form the internal anal sphincter. These are going to be controlled by the autonomic nervous system, which means we are not consciously aware of them. That is being controlled unconsciously. We're not in conscious control. We then have an external anal sphincter, and we are in control of this sphincter. The external anal sphincter is striated muscle, and it's divided into various parts. We have deep parts, we have superficial parts, and we have subcutaneous parts. We can also see we have puborectalis here as well, helping to maintain fecal continence. It's a ring that goes around the rectum. We can see it. It's a ring that goes around the rectum. We can see around here, and that surrounds the opening of the anus, and we can see that going all the way around. External anal sphincter, deep parts, superficial, and subcutaneous parts. Importantly, this is controlled by the somatic nervous system. And when we have the urge to defecate, we can control this, and we can keep this sphincter shut until an appropriate point. I've mentioned puborectalis. We can draw that out again. This sling-like muscle originating from the pubis is formed as levator ani, the pelvic floor, and it blends with the external anal sphincter. It passes posterior to the anorectal junction, creating that anorectal angle. And this is important in maintaining fecal continence. So now let's turn to the perineal pouches. The perineal pouches are found within the urogenital triangle. And within the urogenital triangle, we have the perineal membrane. And that separates the perineum into these deep and superficial perineal pouches. If we look at the deep perineal pouch, that is bounded inferiorly by the perineal membrane, and superiorly, it contains the anterior recess of the ischioanal fossa. Ultimately, most superiorly, we'd have the levator ani muscles. It contains the deep perineal pouch, so everything that is superior to the perineal membrane. It contains the deep transverse perineal muscles, contains the external urethral sphincter, contains the intermediate part of the urethra in the male. Also in the male, it contains the bulbourethral glands, and as we'll see, it contains some important blood vessels and nerves. The superficial perineal pouch is everything that's going to be superficial to the perineal membrane, everything that is below the perineal membrane, inferior to the perineal membrane. And ultimately, this is going to be bound by subcutaneous tissue. It's going to contain, in the male or female, the root of the penis and the clitoris. It's going to contain urethra, contain the superficial transverse perineal muscles, superficial to the perineal membrane, contain vessels and nerves, and in the female, it will contain the greater vestibular gland. So let's have a look. The male perineum, its deep pouch. Now, we've looked at this previously. We've looked at this diagram, which we can see when we looked at the male reproductive organs. We've got the bladder, we've got the prostate. The deep perineal pouch is going to form somewhere where the prostate is here and where we can see this membranous urethra. That's passing through. All of this is going to be in the superficial perineal pouch. And here we have the deep perineal pouch. Remember, we have levator ani running down in here. So, if we look at the cartoon on this side, we can see that we have this urogenital triangle. This urogenital triangle. And what we've got here is this deep transverse perineal muscle. This deep transverse perineal muscle. And that is sitting on this perineal membrane. Look, this little clip here is reflecting the perineal membrane. So the perineal membrane would be all the way over here, but we've reflected it to look into the deep perineal pouch. And what do we find in the deep perineal pouch? We find the external urethral sphincter. We find the bulbourethral glands. We can see these here. We find the deep transverse perineal muscle, all located within the deep perineal pouch. We then have the perineal membrane, which is going to sit over here. The perineal membrane can then sit on top. So, we looked at this in the table in the previous few slides, but it's worth repeating myself. We're looking at the urogenital triangle, and within the urogenital triangle, we have the perineal membrane. And here we can see it's been reflected to open up the deep perineal pouch. Contains the deep transverse perineal muscle. We can see it here. External urethral sphincter surrounding it. Bulbourethral glands, we can see them here. And various vessels and nerves. All within the deep perineal pouch of the male. If we just look at the penis, that is then continuing through the perineum within the superficial perineal pouch, then we can see that we have a whole number of what are known as erectile tissues. We can see if we have a transverse section through the penis, here we have the dorsal aspect of the penis, and here we have the ventral aspect of the penis. We can see that we have these large erectile tissues. See them here and see them surrounding the urethra. Here we have the urethra, the spongy urethra, which we can see here. Surrounding them, we have corpus spongiosum, and positioned more dorsally, we have this erectile tissue, which is the corpus cavernosum. These are important when the penis becomes engorged during sexual activity where we develop an erection. And these become engorged with blood as they fill up like sponges. And we can see we have the urethra surrounded by corpus spongiosum, and we have corpus cavernosum here within the penis. These two erectile tissues. The penis itself consists of a root, the body, and the glands. The root of the penis, which we'll come to in a moment, is attached to the underside of the perineal membrane. So this is located within the superficial perineal pouch. We can see the root of the penis coming here. Here we've got the bulbourethral, so this is the separation between deep perineal pouch and superficial perineal pouch. Here we can see we have the corpus cavernosum, these erectile tissues, and the urethra passing through. The bulb and what is known as the crus are attached to the inferior surface of the perineal membrane, and that forms this root. We'll see those in a moment. The bulb and the crus are covered by some muscles, and these are again within the superficial perineal pouch, known as bulbospongiosus and ischiocavernosus. So now let's turn to the superficial perineal pouch in the male. The superficial perineal pouch in the male, we can see here. How do we know it's the superficial perineal pouch? Because here we've got the perineal membrane. We can see the perineal membrane here. This is anteriorly, this is posteriorly. We've got the anus here, external anal sphincter. We've got that diamond shape being created, pubic symphysis deep here, so it's going up in that direction. But we've got our diamond, we've got our anal triangle here. Eurogenital triangle would be up in this direction. So this is going to be the posterior margin of the perineal membrane. We can see the perineal membrane here. On this side, we have a window into the deep perineal pouch because we can see the deep transverse perineal muscle and bulbourethral glands here. Then the perineal membrane is sitting underneath. Attached to the perineal membrane, we have this muscle, bulbospongiosus, and that's surrounding the corpus spongiosus of the penis. Radiating away from the lateral aspect of the perineal membrane and coming from the ischiopubic ramus, we have the ischiocavernosus muscle, which is surrounding corpus cavernosum. And these muscles are really important. Within the male superficial perineal pouch, we have the superficial transverse perineal muscles, see them here and here, attached to the superficial surface of the perineal membrane. We have the root of the penis, which we can see here, covered by their associated musculature. Here's the root of the penis, the beginning of the corpus spongiosum, covered by bulbospongiosus muscle. Here we have the crus of the corpus cavernosa, covered by their muscle ischiocavernosus, and they're running in this way. These will all form, they will all aggregate in the midline to form that cylindrical penis, which contains the urethra and the erectile tissues. We can see that in a different view now. Here we can see where we've made a coronal section down through the pelvis. We're looking at it from the posterior aspect, so we can see superior here, inferior down here. We've got the apex of the bladder, we've got the seminal vesicles here, we've got the prostate, and in this side it's been opened up. So what can we see? We can see we've got levator ani running down here. We can see we've got the obturator internus, we've got the pudendal neurovascular bundle. We can see we've got the ischioanal fossa, or in this region, because it's the level of the perineal membrane, we can see that we'll have the anterior recess. The anterior recess. We can see that we have this deep perineal pouch here. Deep perineal pouch, and this here we can see is the perineal membrane. The perineal membrane. Sitting on top of it, we'll have the deep perineal space with the deep transverse perineal muscle. We can also see the bulbourethral glands. So we can see these sitting within the deep perineal pouch. In the midline, in line with the urethra, we'll also see the external urethral sphincter. We then have the perineal membrane. Superficial to the perineal membrane, we now find we have the crus of the penis and we have the bulb of the penis. These two making the root. We can see surrounding the crus of the penis, this erectile tissue, we have ischiocavernosus, and surrounding the bulb of the penis, we have bulbospongiosus. And these are located within the superficial perineal space. So now let's have a look at the female, the deep and superficial pouches within the female. And we can see these on this diagram here. We can see we have the perineal membrane over on this side, we can see it here, and we can see the perineal membrane on this side. What we can see if we start with the superficial perineal pouch, this is the superior aspect with pubic symphysis, and we'd have inferior down here. Ischial tuberosities, so we've got the posterior border of the perineal membrane here. we can see that in the superficial perineal pouch of the female, we have similar structures. We have the ischiocavenosus muscle, and that ischiocavenosus muscle is going to be covering the crus of, instead of the corpus cavernosa, but the crus of the clitoris. And that is very similar in orientation to the corpus cavernosum in the male. And again, it's covered by the ischiocavenosus muscle. And these are coming up again from the ischiopubic ramus in this direction to unite in the midline. And here we find the corpus cavernosum of the clitoris. We can see we have the perineal membrane where these are attached. And in the midline, we have in the female the vagina, which opens up into the vestibule. Obviously in the male, without the vagina, this is closed. We don't have an opening. But in the female, for the vagina, we have this opening. And it's flanked on either side by the bulb of the vestibule. And again, this is erectile tissue. The bulb of the vestibule flanks the opening to the vagina, flanks the vaginal orifice here. We can see more anteriorly, we have the external urethral orifice here. So we can see urethral orifice, we can see the opening for the vagina, and then we can see the anus. But covering the bulb of the vestibule, which flanks the lateral aspect of the opening to the vagina, we find we have bulbospongiosus muscle. So analogous structures from both the male and the female. If we were to take these components of the superficial perineal pouch away, we'd then be left with the perineal membrane, and then we can see the opening for the vagina here, and then we can see the female urethra. And surrounding it, we've got the external urethral sphincter. If we were to see the deep perineal pouch, then like we did in the male previously, we'd have to pull this membrane away. Now, located within the deep perineal pouch within the female, we have our urethra, we have the external urethral sphincter. We have deep transverse perineal muscles, and we have part of the vagina. And then in the superficial perineal pouch, like I've just explained, we still have the urethra. It's passing all the way out to the external environment. We now have the superficial transverse perineal muscle. We have the root of the clitoris, just like in the male, we had the root of the penis. And here we can see we have two crura covered by the ischiocavenosus muscle. And then these go on to form the clitoris. We have the bulb of the vestibule that's flanking the vagina. These are covered by bulbospongiosus muscle. In the female and within the superficial perineal pouch, we also have the greater vestibular glands, and these help to lubricate the vagina. We can see these are located in the superficial perineal pouch. So here we can see a view of the female perineum if we were looking at it externally. These are very similar views. So we have the superior aspect up here. The pubic symphysis would be deep to the mons pubis here. And here we've got the more posterior aspect here and here. And we can see in these two views that we have the anal opening here. We have the anal opening here. We can see the anal opening. We'd have the coccyx background here, just like we can see the coccyx here. And then more anteriorly, we can see we have the labia major, more laterally. Then we have the labia minor, and then we have the opening for the urethra and the opening for the vagina. And this region will be the vestibule. If we take away this skin, we can see where we have the glans clitoris here, would be the glans clitoris around about here in this diagram. Here we have the opening for the urethra, and here we have the opening for the vagina. And here we can see the bulbospongiosus muscle covering the bulb of the vestibule. To find the bulb of the vestibule, you'll have to clear away this fatty labia, and if you dig down deep, you should be able to find it. Another view of the female perineum here, and we can see that similar to the male picture we showed, we've had a section, a coronal section down through the pelvis. Again, we can see levator ani muscles, we can see them here. We can see the vagina, and then we can see the uterus here. We can see the bladder, which is anterior, remember, to the uterus and to the vagina. And here we have the urethra, and that is positioned anterior to the vagina, which we can see here. Now, flanking either side of the vagina, we can see we have bulbospongiosus muscle and we have the bulb of the vestibule. And these are hanging from the perineal membrane. And once again, above the perineal membrane, we can see the deep perineal space. We can see it here, containing the deep perineal transverse muscle. And then superficial to the perineal membrane, we can see the superficial perineal space. We can see it here, containing those erectile tissues. We can also see we've got the greater vestibular glands here as well. So a similar diagram to what we saw in the male, in trying to explore the boundaries of the perineum. So what's the neurovasculature of the perineum? What's the neurovasculature of the perineum? Well, we've looked at that because we saw the internal pudendal artery sweeping around in this direction, a branch coming from the internal iliac artery. It's sweeping around. And this, as we saw, gave rise to the inferior rectal artery, supplies the anus and the rectum. It goes on to give a whole series of blood vessels that supply the perineum. Within it, we have the internal pudendal artery. We also have the pudendal nerve. I'm not going to mention the veins, but the veins will follow a similar course to that of the artery. So the internal pudendal artery is going to give rise to the inferior rectal arteries that go to supply the anal canal. It's going to give perineal branch that goes to supply structures in the perineum. And this will branch off to the bulb of the penis or the vestibule of the vagina, the bulb of the vestibule. It'll also give rise to the deep arteries of either the penis or the clitoris, and these supply the erectile tissues. And it will give rise to an artery, the dorsal artery again of the penis or clitoris, that goes to the skin and also the erectile tissues. Within this pudendal canal, we also find the pudendal nerve, originating from spinal cord segments S2, 3, and 4. We saw the inferior rectal nerve passing to the external anal sphincter for somatic control. We have deep perineal nerves that supply the muscles within the perineal pouches, and we also have a superficial perineal nerve, supply the skin of the scrotum, and a dorsal nerve. This supplies the skin of the penis and the clitoris. The branching pattern of the internal pudendal nerve and artery in the perineum is quite complicated, as can be seen in this diagram. We'll just try and follow some of these arteries through in the male and female and see where we end up, essentially. But we've got the internal pudendal artery, which is running here. We can see it giving rise to the artery and the nerve that goes to supply the external anal sphincter. These are running here. These running through your ischianal fossa are going to be your inferior rectal and your inferior rectal artery and inferior rectal nerve. The internal pudendal artery then carries on, and it carries on as the perineal artery, and the perineal artery then carries on running as it enters into the perineum. It gives branches that go to the bulb of the penis. It gives branches that go to the external anal sphincter. And we can see the perineal artery carrying on going in this direction. We can see it's giving rise to some posterior scrotal arteries that run up here. It's also giving rise to the dorsal nerve of the penis. We can see a branch coming off in this direction here that's running to supply the dorsal aspect of the artery. It'll also give rise to a deep artery, and that deep artery will run through corpus cavernosum, supplying the blood that goes into this erectile tissue for engorgement. So we can see this is a particularly complicated diagram with the blood vessels passing into the perineum. The nerves are going to follow, so we can pick out the dorsal nerve of the penis. That's going to run along the dorsal surface of the penis. If we look here at the female, then we have very similar structures. Again, we can see the internal pudendal artery running around in here, giving rise to the inferior rectal artery running around. This internal pudendal artery will then carry on. It will give rise to some posterior labial branches. It will then give rise, as we can see here, the dorsal artery of the clitoris. This is going to supply the clitoris, just like the dorsal artery of the penis supplied the penis. We can see we have numerous veins that are going to be taking venous blood in the opposite direction, and in amongst here we have various nerves, like the dorsal nerve of the clitoris that passes through, and we have the posterior scrotal nerves that are running through this region as well. But you can see that this is a very complicated region, the neurovasculature of the perineum, with numerous structures passing forwards into it to ultimately supply the erectile tissues and to supply the skin of the perineal pouches. So in conclusion, we've looked at the divisions of the perineum, the urogenital triangle and the anal triangle. We've looked at the boundaries of the ischial-anal fossa, levator ani, external anal sphincter, obturator internus fascia. And we've looked at the pudendal canal, an inferior rectal neurovascular bundle that ran through the ischial-anal fossa. We've looked at the perineal pouches, both in the male and the female, the deep and the superficial pouches, and looked at the differences between the male and female. And then finally, we briefly looked at the neurovasculature of the perineum, looking at the pudendal nerve branches and looking at the branches coming away from the pudendal artery.